Hi everyone, welcome back to our podcast called The Research Behind Lift the Lid. I'm Jessica Cooper from Australian Rotary Health, and on our second episode, today we will be having a chat with Dr. Vijaya Manicavasagar from the Black Dog Institute. Dr. Manicavasagar was awarded an Australian Rotary Health Mental Health Research Grant in 2008 for her project, which conducted a randomised controlled trial of mindfulness-based cognitive therapy versus treatment as usual for bipolar disorder and comorbid anxiety, which I'm very excited to discuss with her today. Dr. Manicavasagar is a senior clinical psychologist and conjoint associate professor at the School of Psychiatry at the University of New South Wales, with over 30 years of experience in clinical practice. She's also currently the director of the Psychology Clinic and director of Psychological Services at the Black Dog Institute. Dr. Manicavasagar is well published in the fields of panic disorder, other anxiety disorders, unipolar depression, and bipolar disorder. She has a special interest in adult separation anxiety disorder and is considered an expert in this emerging field. So welcome to our podcast today. How's everything been going for you lately?
Oh, look, it's all good. It's really a bit of an experience getting used to working from home in such a large capacity, and then using telehealth and various video conferencing facilities to communicate with people. It's very, very different.
Yeah. It's certainly, we're building some new skills, so it's very interesting.
Yeah. Absolutely.
Have people been responding to that very well?
Yes, generally so. I find that, most of the people I see as patients are getting the hang of it. I certainly am. At first, I was quite apprehensive, because it feels like there's a little bit of a distance between you and whoever you're talking to. But once you get used to the medium and once you start to get familiar with everything, it's okay. It works.
Yeah.
I think.
Yeah, absolutely. And I know at the moment, with the whole COVID-19 thing, many people are having to isolate themselves, and I guess, this could impact their mental health as well. So I guess getting into it, do you have any tips or words of advice for anyone struggling with their mental health at the moment?
Oh, sure. Look, I think there are so many mental health issues that can emerge because of this imposed isolation that we have at the moment. I think one of the biggest ones, obviously, is loneliness, that despite connecting, online and so on, people still feel quite lonely. They miss the touch, they miss hugging someone that they're close to, or going to someone and holding them if they're distressed. But I think the tips for coping with isolation really, or social distancing really now, is sticking to a routine. I think it's so important to maintain good routines and try and maintain as much of a healthy lifestyle as is possible, eating properly, exercising, and also differentiating between work time and recreation time. When you're working from home, it's very easy for all these things to sort of merge into one another, and then you don't actually have time to relax and refresh yourself.
Yeah.
And also have time out. If you are living in a household where there are lots of other people, if you can maybe have some time to reflect and sort of recharge your batteries on your own, whether it's going for a walk and just being a bit more meditative about what you do, that's very healthy, I think.
Yeah, I guess it's about setting those boundaries and separating the work-life balance and trying to get used to it all. So it can be hard for some people, but I think maybe we've had enough time now. Maybe we're starting to get used to it.
Yes.
Yeah. Well, I know it was quite some time ago now, but back in 2008 was when you conducted that trial of a mindfulness-based cognitive therapy intervention for people with both bipolar disorder and anxiety. So mindfulness is something that we hear a lot about now as a way to help our mental health. Would you say that this was one of the first research projects to gather some of that evidence base for mindfulness?
Definitely. I mean, when we started, it was one of the most pioneering, innovative projects around. We picked bipolar disorder was already not really being researched quite a bit in the psychological sense. I think there are a lot of studies on medications and medical management of that disorder, but hardly anything about the psychological management. And at that time, when we first put together the research proposal, mindfulness was just gaining popularity. It was seen to be very, very useful, especially in treating people with depressive conditions. So depressive disorder, there was some research that had come out regarding the use of mindfulness in that regard. So when we decided to trial it in the treatment of bipolar disorder, it was considered very, very new, very innovative. And we picked bipolar disorder because we thought if it works on people with depressive illnesses, perhaps the depression in bipolar disorder would be, ameliorated by learning some sort of mindfulness skills. But also because bipolar disorder is highly comorbid with anxiety disorders, and we knew that mindfulness, meditation, mindfulness techniques can help with anxiety, we thought that would also help with bipolar disorder. So that's how we came to actually put together the proposal, and fortunately we got the grant.
Yeah. So when you were initially designing that project, I guess what were your main aims? What were you hoping to achieve?
Yeah. Well, because it was such a new area that we were, forging into, we decided to compare mindfulness-based cognitive therapy as an adjunct to treatment as usual. So we got together a group of patients who were very, very, agreeable to volunteer for the study, around 95 people, and we randomly allocated them to treatment as usual. And then the other group, or half of them, got treatment as usual, and the other half got treatment as usual plus mindfulness-based cognitive behavior therapy. And we wanted to see whether that adding mindfulness therapy or mindfulness techniques would actually improve outcomes in bipolar disorder. So that really was our aim. So it was a challenging type of study because we weren't comparing one therapy versus another. It was really just adding on an extra component to treatment as usual and seeing whether that was a difference.
And so we ran. How did that work out? Yeah.
Yeah, we ran several groups, groups of 8 people in each group. We'd randomly allocated them to groups, obviously. And we ran these groups over about an 18-month period. And what we found was very, very interesting because we found that mindfulness-based therapy actually didn't significantly change the number of manic or hypomanic or depressive episodes that people had over a 12-month period. But what it did really affect and what it made a huge difference in was in anxiety. And that was very, very important because it meant that the anxiety that might have otherwise triggered people into episodes was now able to be contained a little bit. People were learning skills to manage it. And that was, as I said, was very, very exciting because we thought now we have a way of perhaps helping people with bipolar disorder manage their own disorder on their own. I mean, with of course adjunctive medication and so on, but at least it gave them a little bit more control over their disorder.
Yeah, absolutely. That sounds like some fantastic findings, and it was probably one of the first of its kind, was it?
It was absolutely the first of its kind. It was quite a landmark study, and people were, other researchers and other clinicians were very, very interested in what we'd found, and as an indication of all of this, I mean, we had a number of publications come out of the research. We had about, I think, 5 publications and conference presentations. It was a really important finding that you could actually help manage bipolar disorder by adding on this component of mindfulness. And the mindfulness-based cognitive therapy component helped people to disengage from their thoughts and feelings, so that when they had racing thoughts or depressive thoughts or thoughts that were really dysfunctional, they were really unhelpful types of thoughts, people could step back and not engage with the thoughts. also the therapy enabled them to not engage with the physical sensations that they were going through, that they were feeling uncomfortable or stressed or panicky or whatever. It helped them to understand not to respond to that and not to spiral into a panic attack, for example. Yeah. It also taught them some basic skills in meditation. So we actually had some meditation exercises which were very, very helpful. People enjoyed those tremendously, and also provided a lot of education about bipolar disorder. So the adjunct to treatment as usual was a very powerful way of helping people manage the disorder.
And so would you say that this is used a lot in clinical practice today, like from these research findings?
I'd like to think so. I've got to say that bipolar disorder is not an area that many psychologists specialize in, unfortunately. So yes, it is used, but it's used in some practices and in some capacity in research and so on. But it's still a very emerging area, I guess. Yeah. Very exciting area, but still an emerging area.
Yeah, exactly. So I guess like from this initial Australian Rotary Health grant that you received, did this lead on to any further projects in this area that, became bigger and, found more?
Yeah. Well, I've got to say, so when we started publishing and, giving presentations and so on, as with most research, the time when you collect the data, could span a year or a couple of years or whatever, and then it takes a while to analyze the data and then to actually write it up and then to finally publish it. So the publications came out over a number of years. I think they started back in 2008 or 2009 and went up to about 2015. So we were publishing regularly, but taking bits of that data and finding something new or something different that we wanted to present. And so there were a series of papers that came out. So we didn't actually apply for further funding because we were still using that data set. It was such a rich data set. There was so much information in it. So anyway, we used that, and we decided that instead of replicating and doing some more of that, because other people around the world and other research groups and other clinicians were also incorporating mindfulness-based cognitive therapy into their treatment with people with bipolar disorder. And from the Rotary grant that we got and all the stuff that went on with that, we developed what's called well-being groups. And they were clinical groups that were run, or still are run, at the Black Dog Institute. And they're treatment groups for people with bipolar disorder. So they run for 8 weeks, and we started running them back, I think, in about 2013. It was a long time ago that we started running them. They run for 8 weeks. They're based on psychoeducation, and of course we do have a mindfulness component in those programs, and they teach people how to manage their the episodes, the highs and the lows in bipolar disorder, and prevent relapse. And to date we've probably treated about close to maybe 200 patients. And the groups have been very, very well received. I mean, we always have a waiting list. We always have people very eager to join these groups. So we feel like we've translated that research into some very practical clinical use.
Oh, that's wonderful. That's what we always like to see with our grants, and seeing them, going out to the public and then being able to use the research that, being able to use the interventions that have come from the research that we fund. So that's really great to hear. So I guess so what about now? What have you been working on, and has it had any important implications for clinical practice? I know you just said that you've got this intervention going on that's being offered via the Black Dog Institute, but is there anything else that you're doing as well?
Well, I mean, eventually what we'd like to do, obviously, is to evaluate those programs. We haven't applied for funding, but obviously that's something that maybe in the future we'd like to do, to evaluate the wellbeing groups, because we know clinically they seem to work. Patients really relate to, or clients really relate to the groups. They find a sense of camaraderie. They find the skills so useful. People, we constantly get thank you letters from people who've been through our groups to say how successful they've been, but we haven't yet formally evaluated any of this. So, I mean, at a later stage, what we would like to do maybe, and we'll probably apply for funding is to actually look at a way to evaluate these groups as they evolved from the initial Rotary grant in the past. Yeah. My area is also in anxiety disorders, as I mentioned to you before, and I have a strong interest in what's called separation anxiety disorder, and that's my other area of interest. But again, we haven't yet worked up some studies that we want to look at just yet.
Yeah, it sounds like you've got a lot of ideas there, and there's always new research that can be done. So it's very exciting. So research, so research funding is obviously very important to keep the work of researchers like yourself going. Do you have a message of encouragement for Rotarians and the wider public to donate to mental health research, especially now during this COVID-19 crisis?
Yes, of course. I mean, I think there's two major areas that I just wanted to mention here. I mean, firstly, research in general is so important to keep us moving forward and helping people, because it's only through research that we actually discover or refine techniques that are going to help people in the long run. And our clinical skills and our innovative programs and developments and things like that can only go forward if we have the research to not only develop the programs but to evaluate it. Because really, if you're going to put anything out there in the public, you really want to have evaluated it and make sure that it's safe and it works and it's worth everyone's time to actually do. So that's one aspect. But the other point I just want to make is that unfortunately with the pandemic, I mean, people's mental health has suffered, and it's unfortunate, but it's obviously affected people with pre-existing mental health problems, as well as people who didn't have pre-existing mental health problems, who are now realizing how much strain they're under or how much stress they're under. I mean, people are under extraordinary stress with financial difficulties, emotional difficulties, sometimes being cooped up, loneliness, as I mentioned before. I mean, rates of, they say, domestic violence might actually be on the increase. Rates of substance abuse are on the increase. And alcohol. So I guess unfortunately there are a wealth of research projects that are probably going to be relevant after this pandemic passes us by, because the mental health, the mental health implications are going to be long lasting. They go on for a lot longer than the actual pandemic. So yes, I think there is such a need and such a great noble cause, I think, for mental health research to alleviate the suffering that people might be having now and will have actually in the future. So I think, there is a very good reason why mental health research is so important.
Yeah, absolutely. Well, thank you very much for joining us on our second podcast, Vijaya. Before we go, I was just wondering if you had anything else that you wanted to add.
In terms of
just in terms of research or anything that you'd like to add.
Oh yeah, look, I mean, I'm also enormously optimistic. I mean, I think that despite all the, as I said, there's going to be a lot of mental health issues and stuff like that. I think we're in such an exciting phase as well of discovery. People are dying to get out there and start doing things. I think right now we're primed to do the best we can do and to really shine. So any sort of research that goes out there now is actually going to be taken up by very enthusiastic people and hopefully carried forward so that it benefits everyone.
Yeah, absolutely. Well, thanks again. It's been really great having you on today and talking about your research. It's obviously had some great impact so far. So that's really great to hear.
Thank you.
Yeah. Well, that was our second podcast, our second episode of our podcast called The Research Behind Lift the Lid. It was wonderful to hear firsthand from one of our previous funded researchers who continues to make a difference to mental health and is helping to lift the lid on mental illness. You may have heard we are currently aiming to raise $200,000 in our COVID-19 appeal to fund more important mental health research like Dr. Manicavasagar's. So far, we have raised $5,780 and we are very grateful for the support, but we still have a long way to go. See the link to donate on the Australian Rotary Health Facebook page. Thank you very much for listening. We hope you will join us again next time.